Polycystic Ovary Syndrome or PCOS is a common disorder which affects nearly 10 to 15% of all women. The condition has various definitions because the presenting features are not uniform. But the three cardinal features of this condition are: 1. Disorders of menstruation or egg production, that is, either egg production may be completely absent or it could be erratic, so that the periods are either absent or delayed or prolonged. Second, features of hyperandrogenism or male hormone. This could lead to the occurrence of acne or pimples, excessive hair growth called Hirsutism, or Acanthosis Nigricans, that is dark lines around the neck or in the axilla. And third is the appearance of the ovary, which gives it the name Polycystic ovaries. The ovaries are filled with multiple small fluid-filled structures called cysts, typically smaller than 10 millimeters in size and more than 20 in number. In addition to this, there are two other features. One is obesity. Some women with PCOS are extremely thin, called the thin PCOS, but a large part of them have excess weight, could be having very gross BMI, and that leads to the obesity or PCOS. Or features of insulin resistance in the form of elevated sugar levels or even fat diabetes. With so many different features, let us see how do we treat women with this condition across different ages of life. In the young adolescent girls, there are challenges in diagnosis because irregularity in periods and some amount of acne is physiological for the first couple of years after the onset of menstruation. So the best thing is to keep on repeating their evaluation and see how the disease evolves. And one should wait for about 6 to 8 years after the onset of menarche if there is any doubt about this condition. Typically, these girls present with irregular periods, and these are treated with the help of hormonal tablets called either progesterone, which needs to be given for about 10 or 12 days in a month, or a low-dose contraceptive pill, which has to be given for 21 days. If there are gross features of hyperandrogenism, it might require specific treatment. But if this girl is obese, this gives us the earliest opportunity to inculcate measures for a good lifestyle, healthy diet, with reasonable amount of exercise, so that this goes a long way in the prevention of many of the side effects of this disease. In the reproductive age, fertility is the main challenge. And this again begins with lifestyle modifications, so that if she is obese, she loses weight, and even a 5% reduction in weight will help in improving the chances of egg production. Egg production can be induced with various types of drugs. Oral medications like aromatase inhibitors or clomiphene citrate. If this fails, we add injectable hormones in the form of gonadotropins. If this fails, we can add insulin sensitizers like metformin. When all these basic oral or injectable treatments fail, or if there are any other indications like problems in the male or blocked tubes, then IVF becomes the preferred treatment of choice. So the treatment of fertility is in a stepwise manner, depending on what the patient responds to and whether there are any associated conditions or not. But eventually, the chances of pregnancy are very good in Polycystic Ovary Syndrome. Around the time of cessation of menses or after menopause, these women are at a higher risk of the occurrence of hypertension and diabetes mellitus. In some instances, due to unopposed secretion of hormones, the lining of the uterus becomes very thick, and they are at a high risk of development of cancer of the uterus. So after menopause also, these women should get the regular surveillance for measurement of their blood pressure, sugar levels, lipid levels, and the sonography to ensure that these long-term consequences do not happen in this field. So even though there is no permanent cure for polycystic ovarian syndrome in quite a few women. If they are under regular surveillance, they take good care of themselves, maintain a healthy lifestyle, and take medications as and when required, polycystic ovarian syndrome will not pose a major challenge to their health.